Today, I have before me Mr. Ashok Choudhary, a 62-year-old gentleman from West Bengal. He came to me 3 years back before COVID. At that time, he had consulted me for an ACL problem in his right knee. I had advised him, but then COVID came and he couldn't come in between. Then he came to me in the month of May 2022. I performed PRP injections to both his knees. He felt pain relief after a gap of 1 month, and then he was comfortable. But however, the pain was not completely gone. It didn't completely disappear. And then he again consulted me in October 2022. So this time I performed MRI scans of both his knee, 3 Tesla MRI scans, and then the reason for the persisting or the lack of total comfort in his left knee became clear. There is a flap meniscal tear in the left knee. Right knee, there is no meniscal tear. Both knees show evidence of grade 1 chondromalacia. I have administered PRP injections to both his knees yesterday. Today it is 1 day after the procedure. He's sitting here in front of me, and now we will talk to him and listen from him about his condition. Welcome, Mr. Choudhary.
Welcome. Yes.
How are you, sir?
I am now okay. I am Ashok Choudhary, 62 years old. Came from West Bengal. I came here with consult Dr. A.K. Venkatachalam for 3 times. First time I came December 2019. I have been suffering right knee problem, ACL problem. That doctor advice all are way, and come to advice to come after 4 months. But pandemic situation all over world has stopped the treatment for everything. Then I came back at in the month of May 2020. Doctor advised PRP. I agreed the PRP injection. Doctor done the PRP the both knees. After 1 month, I feeling something is better than previous, but not completely cured. So I came here with consult and Dr. A.K. Venkatachalam in the month of October 2020. 2022. And this time the left knee is more problematic
Than right knee.
That right knee.
Original right knee pain has better.
Original right knee has better, and advice to MRI and cartilage mapping the both knees. And I have done this all are MRI, and the result comes here. The left knee
Medial
meniscus tear. And ACL right knee ACL mild sprain. ACL mild sprain. After he gave me PRP injection on both knees. On 1st November 2020. 22.
Yesterday.
2022. That means yesterday.
Yes.
After 1 day, today, that is 2nd November 2022, I feel better than previous day.
You are able to walk? You are able to walk?
Doctor's advice, unable to work, everything normal work, that is no problem.
And so you think that 1 dose of PRP is sufficient for many people, for mild without any meniscal tear and all that. But if there is a problem...
but doctor is advised to me the booster dose of PRP. He advised to me the booster dose on both knees. Booster dose for better treatment and future. Future all over work will be done without any problem.
Yes.
Thank you.
Thank you very much. Thank you.